First off, I just want to welcome everyone and thank you for joining us this morning. We're glad to have you with us for building financial resilience into plan design. This conversation comes at a very critical time for employers. I think we're all seeking to innovate and find ways to support employee financial well-being while maintaining sustainable benefit strategies. And that's exactly what you're going to hear um, the team talk about this morning. We also want to extend our sincere appreciation to our Connect 360 educational sponsor, Holista, for their partnership in making today's webinar possible. Holista focuses on delivering high quality, efficient episodes of care, aligning directly with today's theme, actually. So, reducing out of pocket costs, managing plan spend, and improving outcomes for employees and employers. So, thank you to Holista. And with that, I'm going to turn it over to Brian to kick off the presentation this morning.
Great. Thank you, Janet, so much. Appreciate BHCG giving us the opportunity to speak today and talk a little bit about a really important solution that's often overlooked, I think, as people are really struggling to try and figure out how to deal with what is probably the most difficult healthcare environment that most of us have been in over the years. And it's not moving me forward. We have our first technical issue. There we go. I'm not usually allowed to touch the presentations, but I'm going to try and drive it today. I hope not too many people are dealing with fallout from the storms recently and having to deal with claims on their basement flooding or claims of broken windows, etc. But appreciate everyone that has joined us here today. I'm the president of HPS Paymedics and Temple Pay, and Paul Miller is our VP of Business Development and Account Management. Combined, we've got over 50 years of experience in this crazy healthcare world. And as I mentioned earlier, I mean, I think this is probably one of the most difficult times that I've seen over many years. And hoping we can share a little bit today with you all that will help you think through your strategy as you're coming into that time of year. We're going to really share some sobering statistics, a few opinions. Then we'll share a couple of strategies that we can help people implement, and we'll end it with a little bit of results that we've seen when you've consciously brought financial wellness that Janet mentioned earlier into the equation of building out your healthcare strategies in an equitable manner. Let me start by just giving a high-level brush of our company, and then Paul will get in to talk more about these. But we have been in the market for over 20 years. We are located in Milwaukee. We're down on Water Street. We really have had one solution for all these years, which is our network solution in the market. That is an independent PPO network that we'll talk a little bit about the breadth of that later. It has always been a little unique in that it has combined financial wellness with a network strategy, and we'll talk about that. We also acquired a company about a year and a half ago, almost 2 years ago now, that also does financial wellness. It's not built into the network strategy, but it's something that can be offered nationally across the board. Everything we do is about trying to simplify healthcare, helping people understand their statements, helping people understand the billing process, helping people work through that billing process, and most importantly, helping them afford care. So that they aren't delaying necessary care. And that'll be the theme of the conversation we'll have today. I'll start the beginning of the sobering statistics. The Business Group on Health came out with their survey of employers, and everyone's expecting about a 9% increase this year. And many of them are going to be looking to make changes in their plan design to mitigate that. They're doing that at the time when they actually understand that affordability for employees has risen to their number 3 priority. So you think that might be a little juxtaposition there. Affordability at the employee level has always been important, but it's usually been thought about in the context of what is the cost share for an employee of the premium? And how do you benchmark that against others? What's now it's being reviewed as affordability at the member level is really core to just getting access at all and to try and build equity across a population that has many different financial levels of individuals' capability to pay bills. Um, and so that's where there's been a little bit of a difference here. If you look at the past, the average employee is not only contributing towards the contribution, but they're also having out-of-pocket spending that has creeped up to it was real about 3,500 back in 2024. For a family of four, that would expect to be about $4,400 moving forward. I want you to think about that and remember that as I share a few statistics with you. And, I can't blame employers for what they've had to do. Healthcare costs have risen exponentially. When I was a consultant, we would often put strategies on the table, sometimes 20 to 25, 30 things people could think about that focused on network strategies, focused on point solutions or enhanced medical management capabilities. It focused on, what do you want to cover? Things like GLP-1s, are you going to cover those or not? Communication strategies to try and get people engaged, and then plan design. And I would say that almost every time we would always make some tweak to the deductible and out of pocket because it was something that could be done across the board. And then we might implement two or three other unique strategies per an employer based on what their particular needs and desires were and how they thought about benefits as it related to attraction and retention of employees. This out-of-pocket increase in deductible and out-of-pocket spending is really what we're seeing a lot of folks continue to do. This 1.4% buy down on the benefit plan design is the largest that we've seen over the years in these BGH studies. So let's talk a little bit about what that could mean for folks. Well, in today's day and age, 4 out of 10 people are reported to be skipping or delaying care strictly as a result of the cost of care. And 25% of prescriptions are never picked up. So people have been prescribed a regimen of prescriptions and they're not picking them up because they have to make decisions on whether they pick those prescriptions up or potentially put food on the table or pay other bills. And in a study we did, we saw that 92% of folks say that the stress of medical bills actually impacts and exacerbates their medical conditions. So those are fairly sobering statistics that we have to think about when we're building out our plan designs. More importantly, the reason for this is that 59% of Americans cannot afford a $1,000 bill if it was unexpected. So only 41% of folks can actually pay a $1,000 bill if it was handed to them. And yet, as I mentioned earlier, the average family of four has $4,400 of out-of-pocket costs. That's not what they could potentially owe for their out-of-pocket limits. That's actually what is being spent by these employees on average across the board. So those lines don't cross, and it's something that's becoming more and more of a problem, and is what's causing this 4 in 10 people to delay or avoid care. When we increase those deductibles and out-of-pockets, we're also putting more burden not only on the employee and their family, but we're also putting that burden on the providers. And providers are really starting to have to spend more money to collect dollars from patients. They are also having to write off a lot of dollars. And so many of them have now begun to say, we're not going to perform any care that's not emergency based, that you have to have a form of payment on file to do that. And about a year and a half ago, about 28% of hospitals were requiring that. That's up to 43%, and we believe that's going to exponentially increase. So all of these things can actually going to make it potentially worse for folks to actually think about getting care. When the pandemic hit, if you remember, a lot of people couldn't physically get care at hospitals or afraid to go in and get care. And we saw this big impact after that of people showing up with stage 2 cancer versus stage 1, full diabetes versus pre-diabetes. And there's a real concern that if we don't impact these individuals, we could see that same sort of third wave of care having to be delivered. A little bit more statistics that I think are important is that for people making less than $90,000 a year, 67% of those folks are delaying or avoiding care. For African American and Spanish individuals, 73% are delaying or avoiding care. And a statistic that really surprised me was that 50% of women compared to 37% of men are delaying or avoiding care. I've always been in communication employees where we've told the men don't listen to the communications. We have to hit them harder and harder. But there's actually some statistics that show the women are actually delaying care as well. This really calls to a true equity issue that is in play across plan designs that I think people really need to start thinking about. What's the impact? As I just mentioned, when you avoid care, your conditions can worsen. You're going to show up and have care at the wrong setting, and it's ultimately going to be more costly as you think about moving forward. And it's going to also have implications on mortality, presenteeism, and absenteeism. When you do have to engage that care, you're going to draw down your savings. That's going to have you have less stability for emergencies and could cause more delay and avoidance later on. Some people will use their personal credit card, and then they're going to they carry those balances. They're have an impact of significant interest rates that further puts them behind as they move forward. Some might use a medical credit card. We'll talk and show you a comparison in a little bit about how those can be different. This is the care credit type of a program. There's a lot of deferred interest that ends up coming into play that people don't really understand is going to impact them. And one of the things that probably is most sobering to me is that almost 5% of people are actually taking hardship out of their 401k to pay for medical care. I think that was about 2.5% just a few years ago. So it's gone up dramatically over the years. And I was with a customer not long ago that said 40% of their people were taking hardship out of the 401k to pay for medical care. Certainly not the way they wanted to build their strategy out. It was just the reality of what had happened as their plan designs had gone into play. When you think about
Hey,
generations,
Brian, can I,
yes,
sorry, I just, not to interrupt you, but
please.
thinking about the 401k hardship withdrawals, the other thing I would encourage employers to do is look at just 401k loans generally. One of the things I found as an employee, kind of benefits leader was many of the reasons for taking out a loan or multiple loans was listed as to cover medical costs was probably the
Yep.
number one driver of loans. And that's a really kind of scary thing, in my opinion, for employees to have to do.
Yeah, exactly. It should be savings for the future. Thank you for that, Jen. I've been to many presentations. You always need an obligatory slide on how different the generations are. And the reality is that many of you are dealing with 4 to 5 generations in your workforce. And while they all are very different, one thing that's very common across all of them is this issue of the chronic conditions, postponement of care, and just significant out-of-pocket concerns. So that comes in across the board, no matter what different group of employees you're looking at. So tells me there's something we need to be thinking about as we're building out our strategy. There are ways that this shows up for your employees if you're talking to some of them. There's really 4 different ways we think about personas of individuals. I'm really most concerned with the first 2 on this. The folks that are just waiting to get care later because that could exacerbate their care, or the folks that really are struggling to manage ongoing conditions, because those are the folks that are foregoing those prescriptions that I talked about. And the ones on the right are really ones that we can solve for very easily with some additional programs that you would look to implement. I apologize, my mouse is not working as well as I'd like it to be. Let's talk about some of the different options that exist in the market. I mentioned medical credit cards earlier. These are things like care credit that your provider might be offering. A lot of dentists would offer this. It's a great solution if you need money at the time to get something done. But it does require credit checks, so you have to be fairly credit worthy to get credit. And you also have to be very compliant with your payment plan, or you could have significant interest and late fees that come into play. So there's a lot of hidden components to this. And when you think about 20% of folks tend to get declined for credit, this isn't going to solve the problem for everybody. There are a lot of other types of solutions like early wage access programs and emergency funds that employers might put into play. These again have some problems potentially with some soft credit checks. They may or may not have interest components to them and or fees. And again, they're often determined by your financial history as an individual. And the individuals that need the help the most, that are using that emergency room as their primary care, are the ones we really want to make sure we think about. And then there are equity-based programs. This is really typically going to be paid for by the employer, and or some solutions by the provider, that ensure that everybody in a group gets the same level of credit, that they have no interest whatsoever and no fees. And so they really, while they will owe this money, so it shouldn't increase utilization, it is something that allows them to get care when they need it, not when they think they can afford it. These programs often will also include help to find alternative ways to pay back those dollars, like charity care from providers. So what we're thinking about, and we'll talk to you in a couple of different solutions here, is getting to true financial wellness, again, that Janet mentioned at the beginning of the call, that allows you to have a simplified administration, no credit checks, always be interest free, gets you to have utilization when you need it, and ultimately will drive better health and better outcomes. And we're going to talk at the end of the presentation about some results we've seen in our test market in Wisconsin that actually shows quite a bit of this to be true. And now, unless there's any questions, I can't see the chat, but if there are any questions, I'd be happy to answer them about the reason to be thinking so substantially about financial wellness. Otherwise, I'll have Paul jump into a couple of our solutions.
There's nothing in the chat, but maybe just to remind participants that if you do have a question along the way, please feel free to put it in chat and we'll monitor and ask those questions for you.
Okay, great. We'll keep an eye out on the chat as we roll through here. So I'll talk about two solutions. Brian set the table with what's going on in the marketplace right now and what a lot of people are experiencing here around being able to afford to pay for healthcare. This first one, Tempo Pay, that we offer can be added to really any benefits package that you're offering today. It's just a bolt-on that can be integrated right away with anything that you're offering. You can be fully insured, you can be self-funded, you could be with a carrier, you could be with a TPA, you can be with Centivo. This Tempo Pay solution really works with anything. Essentially what it is it's the employer is sponsoring an interest-free credit card for their members to get either all of the following, or you can kind of pick which ones you would like: medical, pharmacy, dental, vision, or vet and pet care. So again, to be a revolving credit where you can set the limit as the employer. You get to choose if you want to set it for, say, $2,000 for any of these 5 categories, any combination of them, and say it's a $2,000 limit, where I can, as the employee, I can go get a virtual card. We'll talk about how this works in a little bit on the next slide, but I have access to a virtual Visa card that'll be no interest to it ever. There's no interest ever applied. A $2,000 line of credit to pay for any of these services. So if I need a root canal, if I need new glasses, etc., I can go. Here, Brian, move to the next slide here. I could, one of our team members has a great story of he had not signed up for Tempo Pay yet. He was at this, his eye doctor and was getting new glasses, and between him picking out the glasses and checking out while they were ringing him up, he had signed up through the app, got his Visa card, and paid for the funds. So what he did then, it was tied to his bank account, or actually to his payroll. Sorry, you can do bank account or payroll. And then he picked out what his payment terms are. So, he paid about like $200 the first month. And so that credit became available to him again. So it's a rolling credit. So you get to determine as the employer what categories you're able to have the interest-free financing for, what the limit is, 1,000, 2,000, et cetera, and then also what the repayment terms. You want to be paying 6 months, 12 months, 18, et cetera. So again, it's from a member experience. You can sign up anytime. It's not like an FSA, use it or lose it. You get access to the card right away. So I mean, if it's something you need, you weren't planning on having these expenses, sign up for it, and then you're ready to go with this interest-free credit card to pay for your medical needs, and dental, vision, et cetera. So we do really all the work for you. We have templates where either if you would like to send them out as an employer, you can send them out. We'll just give you the templates and you can ship them out. Or if you want to give us your employee email addresses, we can send everything out on your behalf, whatever you think your employees would respond to better. But I mean, really, and that's it. From there, the employees sign up and you're kind of out of it. We don't come back and say, hey, so and so owes us money. It's really just a way that you're offering an interest-free way for people to access care, and then you kind of stay out of it at that point. We'll do the marketing. We have a really robust drip campaign to make sure we're staying in front of people, top of mind. So like I said, when we had that team member that needed it, he remembered and downloaded the app and was off and running. So yeah, we really support the employer all the way through and make this really as easy as possible. And again, it doesn't need to integrate with any other program or interact with any other program. It can stand alongside with everything else you're offering. So a very easy implementation process. So, and really what we're doing is we're just expanding the safety net for employees financially. We have, in terms of like our engagement with employees, about 35 to 45% register within the first 6 months. And then a little over half of those, have a transaction, and then they have about 4 to 6 transactions a year. So once people get it, they start using it very regularly. And it's something where, like, if you're running out the door and you forgot to grab your wallet, everyone's got their phone with them at all time. Like I said, it's a virtual card. You can request a physical card if you prefer. And then, really it's a financial support for people. If you don't have an HSA or an FSA or anything like that, this is a great way to offer that benefit, or to offer something in the space. Maybe you don't have a pet benefit today. This could be an easy way to enter that benefit space. But if you have like an HSA available, another great way to use Tempo Pay is, HSA kind of has one of two users. You have people that use it as savings vehicles and they don't really want to touch it, or you have people that basically take whatever the employer contributes and spends it, and they're like, savings? What savings? What are you talking about? So for the first group, those that are using the HSA as a savings vehicle, Tempo Pay is a great way to like protect those savings, right? You can use the Tempo Pay card instead of an HSA card, and then pay yourself back over time. If you want to use your HSA funds, you can pay yourself back through those. But if you want to try to protect those as a savings vehicle, you can use Tempo Pay in lieu of that. And then for that same population, you can have some folks that are in that bucket of like, I need every dollar for my healthcare, right? So this, they're deciding between, do I pay my cell phone bill, or do I, paying for my kids' school programs, or am I going to go to the doctor? I'm going to delay the care. We saw Brian's stats and the whole time, the beginning of the presentation, of all these people delaying care. This gives people a way to pay for that in a high deductible setting where they don't have access to put HSA funds available, or aside, I should say. So even within that high deductible HSA setting, it works well for really everyone across the spectrum. So talked a little bit about this on the prior one, but ideal for anything from a high deductible health plan, copay plans, etc. But in terms of a player group target, if the average salaries is $50,000 to $100,000, that was Brian's stat of anyone with 90,000 or less. 2/3 of those people are delaying care. So I mean, that's a perfect fit for them. And really just trying to build affordability into renewal plan savings. If you're in a position where, like, gosh, we got to raise the deductible and we can't really afford to put any more money into an HSA or an HRA, and our employees are really going to feel the brunt of this can be, a lower cost solution to give people some relief. And then also just a differentiate benefit, to attract employees. Like I said, that pet insurance if you got, is actually really attractive to a lot of people. So this is an easy way to enter that space. So yeah, so that's Tempo Pay. Are there any questions on Tempo Pay? I believe this is my last slide on that. So before leaving that one. So how the
There is
question? So,
a
yep, go ahead,
there
Joanne.
is a question. So, how do you recoup funds from former employees who were repaying via payroll deduction and then have an outstanding balance if they terminate employment?
So we would look for a bank connectivity there at that point to work with the employee. We don't go back to the employer and say, hey, this person owes us money, just to make that clear. We may ask the employer to like, hey, are you gonna have like another paycheck that's gonna be going out? Would you be willing to, have some of that come our way more than what the average payment plan, part of it was, but the employer doesn't have to do that necessarily. So really we'd work with that employee directly at that point. I mean, we have all their information when they sign up. So we would try to get a bank account established at that point, and have them just pay that way. So, but we don't, like I said, we have their contact information from their sign up.
So maybe to add a little more kind of clarity too is with the employers who are using this tempo pay solution, kind of what's the average, if you will, amount that employers are allowing employees to lend or to borrow, I should say.
Yep.
Sorry.
Yep. Yeah, no, it's usually in that $1,500 to $2,000 range in there is the limit that we see most often. Medical pharmacy is obviously the most popular to offer, but we do see a good amount of like dental and vision only as well because people don't have a lot of some people are really focused on the medical benefit. So it runs the gamut in terms of the categories that are offered, but usually it's that 1,500 to 2,000, and that just for the pricing, it's a PEPM. And if you're offering kind of a lower limit, maybe 1,000, it's just vision, it'll be about $2 PEPM. But if you're doing medical, vision, pharmacy, etc., and a 2,000, $2,500 limit, it'd be like $4 or $5 PEPM. So it's in that range, two to five. If you're going really high levels and everything all in, can be upwards of six, but that's the range.
And so that's how you're also providing that protection to not have to come back to employers to recoup costs. Am I correct about that assumption?
Yep.
Correct.
Okay.
Yep. Yep.
Yeah, the
And then,
PPM pays for, the administrative component, the risk charge, risk that we have on the bad debt, and then also the fact that we're lending out dollars at zero interest. And so, again, we really have some incredible underwriting background to say this type of group would have this potential concern with layoff, with number of folks that are have turnover percentage, et cetera, and we'll work that through with the employer. So everybody has
okay.
a little bit different rate, but it's very reasonable compared to what they get because then they're getting care when they need to, and you're going to see the savings and the ROI on the back end.
And then the follow-up question is related to how the PEPM is assessed. Is it eligible population or utilizers, like uptake? And then maybe I would add to that is kind of thinking about once you're working with an employer, how do you adjust that? Or do you adjust that PEPM based off of utilization and experience over any period of time?
Yeah.
It is over eligible, so because you can sign up at any time. We spread it out over the whole population. So it'd be anybody that can access the Tempo Pay benefit would be part of the PEPM. And then usually we have like a 2-year contract where the rate is locked in for a couple years, and then we'd assess based on utilization, whether or not that fee was appropriate. But I mean, we try to, like Brian said, we try to not increase the fee. We haven't done that yet. So we try to keep it where it's at, and get it right the first time. But if there's overutilization, more utilization, I should say, than what we projected, and people aren't paying us back, we might have to adjust the fee. We haven't run into that yet. Vice versa. If it's something we can lower, we would always be willing to lower it if it's based on utilization.
We provide reports that
Mhm.
that the employer can see. We'll get together and talk about a recommunication if we think there's not enough utilization. I mean, we know that that's the most important thing with all these point solutions is are people actually using them? And we don't show a lot of value if they aren't. So we need to make sure we're getting folks engaged. Great questions.
Yep.
All right, I think that's it from the.
Okay, so moving to our HPS Paymedics solution, this is really how we were founded as a company, and we're homegrown right here in Milwaukee, Wisconsin. So we have a PPO network here in Wisconsin, and we do have patient financing tied right into our network. So I'm going to leave patient financing for a couple of slides, talk about our PPO network, and how that works, and then come back and and get to the financing and how that all ties together. But again, we are an independent provider network here in Wisconsin. We have 110 hospitals, over 35,000 physicians. Really, in eastern Wisconsin, we have every major provider. We have Children's, Aurora, Freighter, Pro Health out west, west of Milwaukee. You go north, we have Ascension, obviously. We have Theta Care, Bellin, Door County Memorial, et cetera. We do have Ignesian up in the Fond du Lac area. So we're really robust in eastern Wisconsin. As you go west, we do have Gunderson, we have UW. We just signed a contract with Marshfield that's going to be effective May 1st. So well timed on this to get the word out with that. So that helps, fill in some of those counties north, dark blue for us. And we do have solutions that we can partner with for, number one, the rest of the state if need be. If your population's all in eastern Wisconsin, what would be good with the coverage that we have. And then for the other 49 states, we can work with, say, Cigna or Aetna or something like that to round out the rest of the country. So neither of them are very competitive in Wisconsin. So we kind of work with them. We'll take Wisconsin, you take the rest, sort of a thing. So if we go to the next slide here, we're very competitive when it comes to the larger systems. When you think the Bucas, you think United, you think Anthem. Our network is very competitive. Love to talk to you if you have questions on that. That's not the focus of today, really. So we weren't going to go deep on that, but we are very competitive. And one of the ways we are very competitive with the larger systems, insurance carriers, is our partnership with Holista, sponsor. So happy that they're joining here. They are an in-network provider for us. So what Holista does is partner with independent providers out in the Wisconsin market. They're also in other markets as well, but Wisconsin is really their home state as well. And they partner with independent providers to essentially build an independent network within our network of high quality independent physicians that cover orthopedic procedures, maternity imaging, et cetera, where you can basically call into Holista through us. We have a kind of a partnership where it's HPS episodes of care. You go through Holista, and they can direct you to high value providers right within our network. And again, they're all independent. So when you're thinking about like the overhead of having to go into a hospital versus an independent setting, the savings can be anywhere from 5 or in the smaller end of procedures up to 50% plus of a traditional fee for service at a big hospital system. So we have a lot of our clients use Holista as a major savings vehicle on their PPO network savings. So thanks for sponsoring Holista. Good shout out to you all. A couple of you on the call, I know. So they also have warranties that cover most of their procedures, if not all of them, where if something needs to be redone, it's covered, so that protects the employer. And so what they do is they get a bundled price for it as well. So they get a contract that it's completely transparent. There's no variability in the way that these independent providers bill. So like that Achilles repair is that first example. It's $18,927, and that's the price. There's not, it's not going to be, well, there's 4 billing codes in here versus 1 on this one, and there's no duplicates and stuff like that built in. It's going to be that price every single time. Sorry, it's the price is $8,349. The typical cost is $18,000. So that's the way it's very transparent to the employer on what they're paying every single time. And then you get the savings there as well. And they have an excellent concierge service that directs the care all the way through. Like I said, you call in, you get engaged with them and help out. So next slide here. We work with several TPAs. You may have seen our name come up affiliated with Centivo. We are the broad network option. They obviously have their own networks that they use with their clients, or some of our mutual clients as well. They do have the option of, if you want even, a greater choice for your employees, to dual option with HPS as a broad network. You get all the financial stuff that I'm going to be talking about as well with the Super EOB here in a moment. So be our standard network offering with all the financial savings. But we do work with other independent TPAs as well. Our two biggest is probably Prairie States and WPS powered by Oxyant. And then on kind of the smaller end, for smaller employers, we work with two level funded carriers, Gravy and Crumdale, that we're really excited about. But like I said, we work with a number of TPAs. It's all independent. So again, Centivo, a great partner of ours as well. So yeah, no, we can be very flexible with our network and whatever offering you want to move forward with. So now getting back to the financing, I'll get back to that now. So again, we were really founded by our, on this principle of simplifying the billing process. We kind of backed into creating a PPO network. But really it was about, how do we get people care with removing financial barriers. So our members do not pay anything to the providers up front. They don't pay copay, they don't pay deductibles. They don't, you don't have to put a down payment like, Brian talked about earlier, with the hospitals requiring some down payments just to get the care. So really, what we wanted to do was simplify good timing there, right? We wanted to simplify the process for our members. So you don't pay anything at the time of the care. And then on the back end, you get one statement from us. It's the Super EOB. You don't get, an EOB that says this is not a bill, and then you wait for the provider bill, and then it's like, wait, do these match? Do they not match? Where did I even put that other one? I guess I'll log on and try to figure out where that went. If you just get one monthly statement from us, it's for the subscriber, and then all of the dependents, one statement, everything's right there. We've done all the reconciling for you to make sure you're like, yes, this is what was billed by the provider. This is what your benefit was. Here it is in one envelope, everything together. And then you have one place to pay, and that's us. That's HPS PayMedics. So you call us, we can make a credit card payment online, or if you need a payment plan, just give us a call and you can get an interest-free payment plan. So we really protect the employee on both ends. We give them the access where they don't need to have anything to pay up front. On the back end, I don't have the money to pay this right now. Call us up, get on an interest-free payment plan. So that's our standard plans go to 2 years. We can extend beyond that. And really, the next slide here, we also provide some support. And we will do either inbound if people have a question like, hey, I can't afford this bill. I really can't. Like, what are my options? Or we'll actually do some proactive outreach and get people involved in programs where they can get some of their balance written off through programs that the providers will offer through charity care and things like that. This is a testimonial from one of our members that we actually identified and proactively outreach to them and say, hey, you might qualify for a program to get some medical debt written off. Her husband is on dialysis, has been unable to work, and we reached out to them, gathered some information, filled out all the paperwork for her, and got it submitted, and got a bunch of her medical debt written off through some programs. So really took that off her plate. I mean, a lot of people are, they're juggling work and a condition and life. I mean, they have options, they just don't realize it. So that's where we can come in and really be that helping hand for employees to make sure that, they're able to continue on their care path, getting healthier, while being able to afford it. So any questions on HPS PayMedics as we can go to the results?
I don't see anything. Paul, thanks.
Yep.
Right. Well, let's talk a little bit about what we've seen in the market based on the structure that we have in place with our third-party administrators and our partners. First and foremost, we see trend that's significantly lower than the market average. 1 year trend up through April of this year, 4.5 versus 8.8. If we look at a 2 year, it's 3.3 versus 5.6. That's really it's been 25 to 50% lower for the past 10 years. And we've always seen that the trend tends to be lower. Some of that is truly due to the TPAs we work with and us improving our deals across that time frame. But we also believe a big piece of that is that we are providing the financing up front to help people make better decisions. And one way we look at that is, well, where are people getting their services? And standardly, we have significantly less inpatient and outpatient hospital than the market average, and more non-hospital. So that's the physicians and the ASCs and the independent providers. We could break this down even further for folks if they wanted to see it, but across all categories, the lower cost providers that are really monitoring your care and trying to help you stay healthy versus solving an acute sickness issue are where we see much more utilization. And that's driving a lot of this trend improvement. When we look at individuals, we did a study to break down all of our members that have been here for a number of years. And we looked at that. How are they accessing the system based on the number of times they access the system, the dark blue line, and the average amount that's costing them to access the system. And we wear this with a badge of honor that folks that are really in the low credit score world, which is typically lower income folks, are actually accessing care very similar to those that are much higher income and much higher credit. That group typically is going to be ER first. I'm the board chair of a nonprofit, a federally qualified health center that's focused on Medicaid. Our entire job as a nonprofit or a federally qualified health center is to keep people out of the ER. And those folks don't qualify typically for that when they're on an employer plan. So how do we try and make sure the same thing? We keep them out of the ER where it's going to be much more costly and much less quality, and actually get them to access care appropriately. So that's really some of the proof behind the fact that a lot of what we're doing to bring finance to the table is adding value. And as Paul mentioned, our standard is to allow people 2 years to pay back with whatever they owe. We have many folks that are on longer term plans than that. Currently, our average payment plan is about $3,900, and it's taking people 22 months to pay us back. So that ties into the initial statistics I shared of how many people really can't afford that $1,000. They need time and they need a horizon to pay that back. And when you can do it on a zero interest basis, then when they need care, they're going to go get it. They just know they've got time to pay that back. And our member satisfaction is very high with both our EOB as well as the financing we bring to the table. So I'll just go through a couple of thoughts on how can people really go ahead and assess whether they really have a need for this financial wellness. And again, we're two options. There are many others out there they can be considering, but one thing is to really take a look at your claim data. And if you have the ability to parse it out and look at it based on your salary, it's not going to be perfect because it's not providing household income or credit score, but you could at least take a look pretty easily probably to say, are my lower paid people accessing care very differently? We'd also be happy to do analysis for you on how we think that's breaking out. Take a look at your 401k. Janet mentioned this as well. Are people taking withdrawals from that? Are people actually putting money into their pre-tax, other pre-tax accounts? Or, what we saw in our plan, we used to match what the employee put in. We would match that with employer funding. What we saw is all our high employee folks were putting a lot of money into the HSA and the low income folks weren't. Well, those are the folks that needed the help the most. And so we changed our approach. We also see a number of groups like actually doing surveys and doing assessments of their population to determine what's important for them, to determine if you have a need to go further than you are today. When you think about your solutions you want to implement, we would tell you to really try and find something that serves all of your employees, not just those that are financially stable. Quite frankly, the financially stable folks, this is important to them, but it's not as important to those folks that are avoiding and delaying care because of the cost of it. Are terms really clear? Are there hidden fees? Are there hidden interest rates that come into play that you need to consider with any solution? Or is it truly no fee, no interest across the spectrum of paying things back? And then do you have the ability to engage with your payroll? Can people use their HSA or FSA funds to pay back the money? That's important to be tax efficient. right? But as Paul mentioned, if your HSA is going in every month, it could be 6 or 7 months before you get enough money to pay for something for a procedure you really needed back in January or February. Well, with programs that you put in with no fees but that also integrate with that, you can have people pay back as they get those dollars in across the payment plan. And then can the employees have some ability to determine how they're going to pay that back? What's the parameters of a time horizon that they would have to pay that back based on their specific needs? And so, I think hopefully if we've done our job properly, we're helping you understand that, the decisions that you make in your plan design, how you work through things, can have a major impact on whether people are getting care. And whether they get care could have a major impact on your overall costs, your absenteeism, and your presenteeism. And that there are solutions that exist to really help people engage in a manner that adds equity to the equation and ensures people are getting that needed care, so that they don't become that high cost claim down the road because they didn't have things taken care of when they needed to have them taken care of. Jan, I know we've got a little bit of time left. Is there any questions from folks or any clarity that we need to bring to the table? We'd be happy to share anything.
I have maybe one thing that you could add to, when you're thinking about your previous slide and assessing the need, reviewing medical claims, completely think that is valid, but you also mentioned that there are employers utilizing this type of service for just dental and vision. And so I think it's worth a mention about maybe what employers should be looking for in those categories to assess whether or not this might benefit their population.
Yeah, if you think about on the dental side, it's that person that needs to get a crown redone, but is putting it off because the 50% coverage is still going to cost them $600 or $500. So they put it off and put it off, and then they need a root canal. Then they're out of work for a day or two, and when they're there, they're not feeling great across the board, and that's going to be significantly more costly to both the plan and the employee, right? So really, it's looking at preventive care. Are people engaging in that appropriately? And just making sure you fall within lines on the other restorative and beyond basic care to make sure that things are being done. And on the vision side of things, if you think about it, it's that person that gets a new prescription, but they don't have the money to get those prescriptions put into their current those new lenses put in their current glasses, or they need to get new glasses. They're delaying it, and so then they're having trouble seeing. They're getting migraines. They're having to, give their eyes a rest over time. So again, same thing on that side. It's a little bit harder because that's often, handled as a voluntary benefit. And so oftentimes people that are choosing it they're choosing it because they're going to use it. But still taking a look at the usage of the program and how does that fall in line with where they are, and maybe asking your vision entity, did you see that a new prescription was implemented but somebody didn't fill it? Or they might be asking questions to folks that are out there. Those are some of the things to think about. The vet care side of things that Paul mentioned. A lot of people are implementing voluntary vet programs. But this could be an easier way to even do it. Again, they don't get any insurance, but they would get time horizon to pay that back. That's probably more something you'd get from a needs assessment than you'd get obviously from seeing any kind of data. Jim, the one thing I neglected to mention because I had this dynamic approach to this is when you think about engagement and you think about all the different point solutions folks are implementing today, enhanced medical management programs, utilization management programs, programs that are helping people with medication management, initiatives that are helping with centers of excellence, things like that. You can't engage anyone in a program until they've actually gone and be seen by someone in the first place. right? You need to get some lab scores. You need to get, the primary care visit. And if so many people are avoiding even that, and even though in many instances that primary care visit might be free, people still aren't going to get it in large part because they have this concern that they are going to be diagnosed with to have to get some drugs, or they are going to be diagnosed to have to see a specialist, and then they have concerns on the back end. So removing some of that financial friction could actually gather more data for you in your population and gather data for some of your solutions that are trying to engage your population, because now they've got more information and more dot points to pull through. So I neglected to share that, but that's an important piece of why it's important to get people to get utilization. I started my career as an underwriter. We loved no utilization. We used to think that was the way to measure how much cost people would have, right? And in today's day and age, you see a lot of pricing that's still based on increase your deductible and out of pocket, and you're going to have a lower premium cost. Well, I think that's missing the point that it's causing this delay that's then causing issues down the road. So some of us, and I'll put myself in the equation, we've been part of the problem. We pushed and pushed and pushed consumer-driven healthcare, without maybe making sure the tools existed to get people to get care. But then now there's a lot more effort into making sure the tools exist. There's transparency information, there's navigators, etc. But then there's still that little piece. You can be navigated, you can have the right tools, but if it's something costs $1,500 and you don't have it, you're either going to wait till you have it, which could exacerbate your condition, or you're not going to get it done at all. And so pulling all these things together into a comprehensive package for your employees is super important, and something I hope everyone thinks about as they're thinking about what they have to do with their plan design to get to the right cost structure for both the employer and the employee. Jen, I think you're on mute.
I am on mute. Thank you. I was saying that's really helpful context, I think, and good to think about. I was also thinking about as we are challenged with meeting our internal employer budget numbers, right? And we start thinking about maybe how to find any amount of cost. It is things that we may start to turn to, like dental, and eliminating or reducing some coverages, or having tighter annual maximums and things. And so it is something that can also help alleviate the burden of that communication to employees. And although you're adding a bit of cost, you're not adding as much cost as you're potentially taking out. So, there's that option as well.
Yeah, very well said.
Awesome. Again, as always, we will prepare this webinar and make it available to those who couldn't join us today, but then those of you who were here, if there's anything you want to revisit, you'll have access to that. You can also find Brian and Paul's contact information on our website. HPS is an affiliate member, so please, if you do have further questions, don't hesitate to reach out to them or to Jennifer and I directly, and we'll connect you. So appreciate it, you guys. This was really informative.
Thank you so much, Janet. We really appreciate all you're doing for the market and making sure people understand options that are out there.
Thanks, guys. Have a good day.
Take care.
Thank you, everyone.